All right, let's move on. We've got Aloyce now, and he is going to talk about malaria in a perfect storm. I think there's something different on your agenda, but that's what he's going to talk about. Thank you.
Thank you very much. My name is Aloyce Urassa. I work with the African Leaders Malaria Alliance as a technical lead for private sector engagement. ALMA is a coalition of the heads of states, the 55 heads of state of the African Union, who are united to put malaria agenda high. And today I'm going to speak about the perfect storm, malaria in a perfect storm. Most of the time when you hear the word perfect, it means good. But today, I'll tell you a bad story about that word, in a perfect storm. It's a time for a big push, bold, and united actions, as most of the speakers have reiterated. And I don't want to repeat much of the words and calls to action that have been made here. I'll just share with you a brief story. And
it's time for a story. A tale as old as time rages on as dangers combine. A perfect storm lies ahead that steals small children from their beds. As our enemy grows, a bloodthirsty thief, the path to zero will outwit our grief.
It's a long path. It started with the dinosaurs.
Roar!
The dinosaurs fell, but the mosquitoes still came.
Fast forward 2 gazillion years.
The mosquitoes still come, spreading malaria in the darkness of night.
But this time, we're ready for them.
I remember when the sky got really angry. The rain came down so hard, it was like elephants dancing on the roof.
I remember when my brother was in my mama's belly. Mama got sick and couldn't stand up.
I remember when my best friend wasn't in class. The seat next to me was empty. The seat next to me had never been empty.
The kitchen chairs began to shake. The roof flew away. As the house started to fill with water, Papa said, "Got it!"
She was soaking wet with sweat, then Mama got still, so still.
The seat was empty again the next day, and the day after that. I ran to my best friend's house.
Our house was gone. The greedy water took it all. Our beds, mosquito nets, and my favorite toy. We ran to school to hide. It was the scariest time of my life.
I felt terrified as I knocked on the door. My best friend's mama answered. She was crying.
I've never seen my papa cry before. The health worker told him to go grab some of her things. She said, "We must take her straight to the hospital."
He said, "Você estará segura aqui." The men in yellow had found us a place in our classroom to sleep, but the storm had taken away all our nets. Mama said we were like a gigantic meal for mosquitoes. Eventually, the sounds of sickness began.
Malaria.
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 Not here.
Again.
Malaria.
We know we can beat you.
Our units can stop you in your tracks.
Our medicine can take you down.
Our local health heroes can keep us safe.
Our scientists are fighting for our lives.
Our sprays can blast you away.
Our clever technology will reach you wherever you are.
And can keep us safe from the scary storms. Our vaccines can be our shield.
But all this cost.
How this tale will end, we must now choose. For the path to zero is a fight we cannot lose.
It's time to change.
So it's really a time to change the story. All that we have had, it's because we really need to change the story. We need to change the story of a kid dying in every minute because of this very preventable disease. It is faced with a perfect storm of challenges: climate change, disrupting lives of many families. And unfortunately, most of the devastating impacts of climate change is happening in places where malaria is already endemic. Financial threats, doubling of the population. Population is highly increasing again in the same countries where malaria is highly endemic. making it even more difficult to fight this disease. Biological threats, we have had so much since morning of the resistance and everything. It's time for us to change the story. And we are the ones to change that story. On the serious financial gaps, we had some questions on our tables to answer. How the US funds cut have been affecting the bilateral and multilateral efforts in addressing the fight against malaria. This year, we're expecting the US government to supply over 45 million nets to malaria-endemic countries, 70 million ACTs, the antimalarial drugs, 100 million RDTs to protect more than 8 million children. Unfortunately, these funds are already highly compromised to protect over 15 million people. And the Global Fund is already asking countries to reduce their funds by estimated almost 30%. Many of these countries are already having a huge deficit in their budgets, yet they have to reduce it. You can see why we are needed to change the story. We need a big push to respond to this perfect storm. All these things, the big push is all the stories that have been discussed here since morning, multi-sectoral coordination, to improve coordination amongst ourselves as Rotarians, with our clubs, to increase the partnerships, to work together, to think together, so that we can really change the story. To drive ownership for the countries, as what the small grants are addressing here. To strengthen data systems, all things have been discussed, and I won't repeat much. At ALMA, we are looking at these top 4 priorities: strengthening data. We have been training Rotarians on the use of these scorecard platforms to utilize that data to inform the decisions that they're making in countries. But we're also creating youth core. We are supporting youth, and recently we have launched 16 youth cores, malaria and NTD youth cores in 16 countries, which we are supporting with knowledge, trainings, and thanks to Rotarians who have been supporting some of them, like in Kenya, the Rotarians Against Malaria, giving them grants to support their communities. But also we are supporting establishment of Malaria Councils and funds. Mr. Patrick spoke here in the morning, who is also part of these councils that we have in Zambia, and in many countries where Rotarians are part of. But also, mosquitoes don't know borders. They don't respect borders, so they cross to other places. So we also support region economic communities to ensure that there's cross-border collaboration for countries to engage together, brainstorm together, and work together to address this burden. These are some of the scorecards. We have a continental scorecard that we share with heads of states every quarter. We have region economic block scorecards for the region economic communities, ECOWAS, SADC, and everywhere to share and learn from each other. But also we have country-specific scorecards on malaria, on reproductive, maternal, child and adolescent health, NTDs, neglected tropical diseases, and nutrition. This is for the sake of also integration, which we highly promote integration while addressing malaria. As Philip addressed much of that, fighting malaria is not just fighting malaria, it's addressing a lot of other things. But also we have community scorecards to engage the communities at a very low level, where we have communities assessing the quality of care at their level. Rotarians are key, as Xavier said. They're already part of these programs, like the Malaria Councils. We have them in Tanzania. Rotarians are supporting with resource mobilization. In Uganda, they supported establishment of this Malaria Council named as Malaria Free Uganda. We have Rotarians working in Nigeria, in I can't read maps well, Mozambique, Zambia, and many other places where Rotarians are already engaging. Some of the areas of partnership, I won't repeat, it's all that has been discussed here on what Rotarians can do around partnership, participating in country task forces, like through the civil society mechanisms, establishing more malaria councils and funds in the countries. This is a really good role that Rotarians can play. But beyond that, many of you are also part of different private sectors where you can engage through your private sectors or other institutions, either non-state actors, to respond to the fight. I won't say much the role of youth. Everyone, I'm sure, acknowledges from the first opening speech we had of the role of youth. These are some young people in DRC playing games with children, talking about malaria, what they can do, and they also did some cleanness in their communities. The other picture is from Kenya. That's the project that RAM Global supported in Kenya. And in all other countries, Nigeria, young people doing motorbikes to raise awareness. In Cameroon, and the picture there is when we brought all the 16 countries in Nairobi to brainstorm together to come up with solutions as the next generation. What are we going to do to make sure that we really end malaria for good? I personally am also a Rotarian, and I've been working with RAM Global on their board. I served for 3 years, since 2021 to 2024 June. And we have worked to distribute over 20,000 mosquito nets in Tanzania across different communities, trained community health workers, young people, which is my really passion, and I'm also young people, given bicycles to community health workers, educated through churches and schools, written a storybook. You can see kids reading there. We wrote a storybook for the kids to learn about malaria and educate their parents, and also using Rotaractors through storytelling and read of books, magazine. But the other picture you see, Eric said young people are confident. This was during COVID-19 when nobody wanted to travel, and we formed a team, volunteered, and went to deliver mosquito nets in all facilities in one of the districts, but also all the boarding schools in that area because our government opened schools during COVID, so we had to at least protect them from malaria during that moment. And it's me with my team. We went there through the support of Rotarians. Thank you very much for encouraging and supporting and boosting our confidence as young people. And really, it's time to end malaria. It's time to change the story. We are the ones to change the story. And I look forward to one day standing somewhere to say, we declare a zero malaria world. Thank you very much.